Imagine hearing voices that nobody else can hear, or becoming convinced that something is true despite overwhelming evidence against it. For millions of people living with schizophrenia, these experiences can feel frighteningly real. Yet schizophrenia is far more complex than many people realize, and despite more than a century of research, scientists are still uncovering how this disorder develops and how best to treat it. Today, we'll explore the science, the myths, and the hope behind schizophrenia. Schizophrenia isn't just one disorder, it's considered a syndrome, a collection of related conditions that share overlapping symptoms but may have different causes. That's why no two patients look exactly the same. Early warning signs are often subtle, a sudden drop in motivation, irritability, or unusual thoughts creeping in gradually. Full-blown psychosis, the hallmark of schizophrenia, usually appears in late adolescence or early adulthood, typically in the late teens or early 20s for men, and later for women. When psychosis strikes, it may include positive symptoms like hallucinations, delusions, or disorganized speech, experiences that go beyond reality. Negative symptoms, which strip away normal abilities such as motivation, emotional expression, and speech. Cognitive symptoms, such as trouble focusing, remembering, or making decisions.
One of the most persistent myths is that schizophrenia means having multiple personalities. In reality, schizophrenia affects how a person interprets reality, thinks, and processes information.
So, what causes schizophrenia? There is no single answer. Instead, it's the result of a complex interaction between genetics, brain chemistry, and environment. Genetics: about 1% of the population develops schizophrenia, but the risk rises sharply in families. A sibling or parent of someone with schizophrenia is about 10 times more likely to be affected. For identical twins, the risk can reach nearly 50%. Scientists know that multiple genes, not just one, are involved. Brain structure and chemistry: brain scans show that some patients have subtle differences, like changes in the size of brain regions, disrupted connectivity, and imbalances in neurotransmitters like dopamine and glutamate. Excess dopamine may fuel hallucinations and delusions, while too little in other brain circuits may explain lack of motivation and emotional flatness. Environmental triggers: complications during pregnancy, exposure to viral infections in early life, or malnutrition during fetal development may increase risk. Later in life, heavy stress or certain drugs can act as triggers in genetically vulnerable people. One of the most debated environmental factors is cannabis use. Research shows that marijuana, especially high-potency cannabis, can increase the risk of psychosis in individuals who are genetically vulnerable. Using cannabis during adolescence, when the brain is still developing, may accelerate the onset of schizophrenia or make symptoms worse. Not everyone who uses cannabis develops schizophrenia. For most people, it doesn't cause lasting psychiatric illness. But in those with underlying genetic risk, cannabis may act as the trigger that tips the balance. Long-term heavy use has been linked to more frequent hallucinations, stronger paranoia, and greater difficulty with memory and focus. This is why many psychiatrists caution against marijuana use in teenagers and young adults, especially those with a family history of psychosis. Schizophrenia is usually diagnosed after a psychotic episode. Treatment has improved dramatically, but there's no one-size-fits-all cure. Antipsychotic medications remain the main treatment. Traditional drugs reduce positive symptoms by blocking dopamine, but they may worsen negative symptoms or cause side effects like weight gain and tremors. Newer, atypical antipsychotics target multiple neurotransmitters and aim to balance benefits with fewer side effects. Psychological therapies such as cognitive behavioral therapy, CBT, help patients cope with delusions, improve social functioning, and manage stress. Electroconvulsive therapy, ECT, though controversial, has shown benefits for severe cases resistant to other treatments. Cutting-edge research, brain stimulation techniques like transcranial magnetic stimulation, TMS, are being studied. Anti-inflammatory treatments are under investigation, since schizophrenia may involve immune system dysfunction. Digital tools, smartphone apps and virtual reality therapy are being tested to support daily functioning and social skills. Early intervention is critical. The earlier treatment begins after psychosis, the better the long-term outcome. Perhaps the most damaging aspect of schizophrenia isn't just the illness, but the stigma surrounding it.
Media portrayals often create fear around schizophrenia, yet many individuals living with the condition face discrimination, isolation, and victimization, rather than posing a threat to others.
With treatment and support, many can study, work, and lead fulfilling lives. Education is one of the most powerful tools we have. Educating families, communities, and even healthcare providers helps break down stigma and opens the door to early diagnosis and effective treatment. Scientists are now exploring how the gut microbiome might influence brain health. Whether precision medicine, tailoring treatments to someone's unique genetic and biological profile, could replace the trial-and-error approach to medication. How AI and brain imaging could predict who is at highest risk before psychosis even starts. The future of schizophrenia research is about more than just treating symptoms, it's about prevention, personalization, and restoring quality of life. Schizophrenia is not a hopeless condition. It is a deeply complex disorder shaped by biology, environment, and society. With compassion, education, and science, we can continue to replace stigma with understanding, and transform the lives of millions. So, the next time you hear the word schizophrenia, remember, it's not about split personalities, it's about healing the mind, protecting dignity, and unlocking hope.